Hi, I'm Ben from Hands to Heart Massage. Welcome back if you've watched one of my videos before, or welcome if this is the first time that you've watched one. So I'm going to talk about lower back pain today, a really common problem. I see, in quite a lot of clients, 80% of people get lower back pain sometime in their life that puts them out of sport or work for a little bit of time. The lower back pain I'm talking about is that belt of pain that runs across the lower back, or at the top of one of the hips when you go to bend over, it just catches and feels really tight. So to talk about it, there's quite a bit of detail with it, so I'm just going to run generally through 3 or 4 things that you can look at in yourself and say, hey, that's how I am, and how to affect that in a positive way so back pain is less of an issue for you. So I'm going to start with the pelvis. The pelvis are like the 2 butterfly wings, which is like the ilia, and there's a sacrum in the middle which sits between those. Now that's got to be level like the base of a building. So imagine this is your pelvis, it's got to be level. In a good building that would be the case, and then the building that sits on top of that would be perfectly vertical, which would be your spine. Now if that building is affected in any way by the base, in which could be tilted or twisted, then it's going to affect what that building does. If it's like this, it's going to do this normally, but your spine and brain being really smart says, I want my eyes to be level. So if it tilts like this, your eyes aren't going to be like this, they're going to want to come up and be level. That's going to affect your spine, particularly where that starts is in your lower back. And that's where a lot of the compression is, that's where a lot of weight happens just through gravity, through standing and sitting through the day. So that's when you're going to basically feel it the most at the start. So I'm just going to run through the pelvis positions, and you might identify with one of those, and I'll show you how to actually alleviate that position and help get it towards a more neutral, balanced base or balanced pelvis over time. It won't happen overnight, but these things you can do to help alleviate that, and your back pain should slowly dissipate, or be a lot longer between times when you feel an issue with your lower back. So I'm going to start with a basic one, and that's a tilted pelvis. So when I say that, that's meant to be square. This is exaggerated, but someone's hips might be like this. And the way you'll be able to tell that is if you line yourself up on a wall or in the mirror and you have a look at your shoulders. If one shoulder's higher than the other, it's generally a good indication that the hip is tilted. And I'll give an explanation. Say your hips, again exaggerated, most people aren't like this, your hips are tilted like this, your head isn't going to stay like this, your eyes want to be square, so what tends to happen is your eyes get square. This hip's low, this shoulder ends up high because it has to come up to get your eyes level. So if you stand there and you have a look and you go, okay, this one's high, okay, maybe my hips are not level, then things you can do is stretch out the other side, because you're going to get compression into the opposite side. As soon as we do this at the base of your spine, you do this, you're going to compress the other side and get a bend there. So one easy way to do it would be to grab a door jamb, like this side on, and stretch out the other side. Stretch out the other side. Okay? And just simply by doing that, you're going to even up the compressed side with the one that's actually trying to rotate the other way. You will need to see a therapist that can help you bring your legs into alignment. That generally happens with a tilted pelvis if your legs are a little bit shorter one than the other, and that could be function, that could be many reasons, and I won't run into that today. You're best off seeing a therapist and helping them to work you through that. But basically, just to alleviate that, if you see one shoulder up and side higher than the other, just do that sideways door stretch. On that side, obviously, if that shoulder's up, I'd do it that way, or I'd do it this way if this shoulder's up, and that'll help bring your pelvis a little bit more back into alignment. The other one is it's called an anterior rotation, so it rotates this way. And to put that easily, it's someone that has a bottom that pokes out quite a bit and they've got quite a curve in the lower back. I call it duck bum. You see them, you walk along, with their bottom sticking out quite a bit. And that means that they're generally tight through their hip flexors, which join from the inside of the legs up to the front of the spine. Now when that happens, it pulls on the front of the spine, makes that curve greater, makes their bottom stick out. So if you're one of those people and you notice, I do have quite a curve and my bottom sticks out as I walk or I run, then you really want to work on the hip flexors. You can do that by stretching it, stretching the right one, having that back, leaning into it, coming up. You could use a tennis ball, which you would put on the inside of that hip and you would lay on the ground. And then you'd roll around in that area. It's quite tender, it's not that pleasant, but it helps alleviate one of those major hip flexors. So they're just two things you can do to alleviate that forward rotation of your hips. Second is an anterior rotation of your hips, which is, you'll see some that have no bottom. Basically their back's pretty flat and you go, oh, they've got no bum. It's really because their hamstrings are really tight. They attach to the bottom of the pelvis, they make the pelvis tuck under, then it makes you lose your bottom, makes your back look flat, and you'll see them walking around sort of really straight back and no bum. Now if that's you, as I just mentioned, your hamstrings are really tight, you might be someone that says, yeah, they've always been tight ever since I've been a kid. Just work on that over 4 to 6 weeks. If you just start stretching them daily, then you're going to find that your pelvis is able to rotate into more of a neutral position. There's a neutral position which isn't too far back and too far under. Once it's in that neutral position, then when you're going to bend over, your back's not as compromised. Imagine if your hips are tucked right under, as soon as you go to bend, you're already tight. Your hips are at the top here are already on a stretch, so you're trying to stretch something that's already under tension. And that's why you'll get pain either through the lower back or on one side. So yeah, if you're a person with that sort of posture, really work on your hamstrings. The big thing I see with people when they stretch hamstrings, they just bend over like this, or you know, they might put it up on a chair or something. I find the best one to do is actually, so I'm just kneeling, I'm putting my heel on the ground, I'm leaning forward into that, and I can touch that. The key component here is you've got 3 hamstrings. So what you would want to do is test that one. Take the leg across your body, test that, take your leg outside your body and lean forward. Always lean forward, but move your legs, that'll test the 3 hamstrings. You generally find 2 of them are tighter than the other one. One you won't really feel, you don't need to stretch that. You'll probably find the middle one, and if you take it across your body and lean forward, use something to land on if you can't balance too well like myself, and you'll find that it will stretch your hamstrings in a different way. Okay, so we've run through rotation this way, rotation that way, and tilting. And the last one is a rotation if you're twisted this way. So imagine this is square and I'm twisted this way. What will happen with my eyes is I want to look square on. So if I'm twisted this way, I'm going to be looking at a bit of an angle. My head's going to twist, so my whole spine's going to do a twist and create and compromise the lower back. And the way you might be able to see, that's not always the case, but if you do a little bit of a walk on the spot and you've got a line in the floor and you line your toes up, you might notice, hey, one quad is a bit forward than the other, which means that your pelvis is twisted, and you might go, oh, okay, why is that? And generally it's because your glutes, which stabilise and are involved in holding your hips in what's called external rotation, one might be weaker than the other, or one might be over dominant. And a good way I like just to test it, or a really simple way to test it, and it's not the only way to test it, and again, see a therapist, especially if you've got that rotation, they'll be able to help if it's length or strength. But if you do a simple Pilates test of just the side plank and you're doing leg raises, point your toe down because it'll isolate one of the major hip stabilisers. If you're doing these in a controlled manner on one side, and then the other side, you actually might find that, let's say you do 10, 12, 15, that one side after 8 gets fatigued, the other side can go through to 12 or 15 without the same sort of fatigue. It means that you're going to be dominant or stronger on one side, and you really need to build up the other side, because these hip stabilisers help twist you out this way. When one's dominant, it'll twist you, or if one's weak, which is generally what I find, one isn't functioning as well, it'll switch off and the other one is doing its job, so it'll twist you in that direction. The last one is your core. You hear about your core all the time, and just simply by doing that, that's going to help take load off the rest of the body that's not meant to be doing the stabilisation. You know, as soon as your core doesn't work, your legs have to do some work, your lower back has to do some work. And most people, when you talk about core, they're not really sure on what do or test if it's working. I really suggest, if you're having back issues, to visit a Pilates teacher one-on-one and spend an hour with them and get them to really teach you how to activate your transverse abdominis and your obliques and that sort of thing. Because once you do that, that's invaluable. Your brain will then know how to switch it on. You can do it at home by yourself, and it's going to do a lot of stabilisation to hold that pelvis in the position it needs to be. Okay, so a simple test. If you want to buy one, or it's not just for testing. I wouldn't buy one just for testing. I'd also buy it for feedback for you, for your core, because a lot of people do core, but as soon as they get functional, which means as soon as they go to move, the core doesn't switch on, which is something I find pretty regularly. And a simple test is, this is just the blood pressure. It's got a sphygmometer or something is the other name it goes by, but blood pressure cuff. You just roll it up like this. Put it under that part of your back, so you do like your back's flat on the ground. Well, sorry, your feet are bent at 90 degrees, and you put this under the part of your back in which you can feel that there's the curve. I've got the gauge here. Now, I'm pumping it up until I can feel that push into that lower part of my back. Then I turn my core on, and I should see the needle go up. If you're not seeing the needle go up when you turn it on, you're actually not activating your core. Now what you want to do is, once you've turned it on, is just lift one leg off the ground, and you're only doing it an inch, and then the other. Now what you're looking for is, on the gauge, when you turn your core on, it'll go up to a number. If you lift that foot off the ground and you see the number drop and stay there, or drop and then come back up, your core switches off when you do a functional exercise. And you might find that happens on both sides or just one side. Now that'll give you feedback. If it's both sides, obviously you can work on it. If it's one side, you'd want to work on that a bit more than the other. And you can use this as a tool, and a feedback tool, when you're doing that exercise, to actually activate one or both of those sides. So that's it for me. That's just a little bit on the lower back pain. Again, it just comes down to how level is the base of your building. And it could be twisted this way, it could be twisted this way, or again, this way or that way. And there's a few little indicators I've given you there, which one of those you might be. Again, it's always good to go to a therapist, because they'll be able to see it and prescribe something that will help you actually balance those out. And it will take some work. It won't happen straight away, but if you've had back pain, or it's something that you experience infrequently, to stop that happening, you've just got to balance out that base, your pelvis, and you'll find that, yeah, you won't get it anywhere near as much, if not at all. Thanks for spending the time. I'm Ben. I'll catch you next time.